You feel it coming, that clear, unmistakable urge. You sit down and either nothing happens or a small hard piece passes and you're left with that frustrating sense that something is still there, stuck right at the exit. If that sounds familiar, you're not imagining it. The stool really is stuck, not high up in the colon but low, right in the rectum. And that is a completely different problem from ordinary constipation, which is exactly why most laxatives don't help. In the next few minutes, I'll explain why this happens. The simple remedy that can get things moving in as little as 30 minutes, and how to stop it from becoming a recurring problem. Asterisk, 2 different kinds of constipation. Here's the distinction most people are never told. There are 2 very different types of constipation, and they require 2 very different solutions. The first type happens higher up. Stool moves too slowly through the colon, dries out along the way, and takes days to reach the exit. This is what most laxatives are designed to address. The second type is what we're talking about today. The stool has already made it down. It reached the rectum, and once there, it stopped. This is called outlet constipation, or dyschezia, and it's remarkably common, especially after age 50. Asterisk, why it gets stuck right at the finish line. Think of the rectum as a holding chamber, the last few inches before the exit. Wrapped around the base of it is a muscle called the puborectalis, which functions like a sling. When you're upright, sitting or standing, that sling pulls the rectum into a slight kink, similar to a garden hose with a bend in it. That kink is what keeps you continent throughout the day. But when it's time to go, that muscle needs to relax and release the kink. If it doesn't fully relax, stool reaches the bend and simply stops, compounding the problem. The longer stool sits in the rectum, the more water the body continues pulling back out of it. The weight makes it harder and drier, and eventually you're left with a firm plug at the exit that won't move on its own. The common contributors are familiar ones: low fiber intake, insufficient water, ignoring the urge when life gets busy, certain medications including opioids, iron supplements, and some blood pressure drugs, and pelvic floor muscles that have simply lost the habit of relaxing on command. All of these become more common with age. And straining only makes things worse. Pushing harder doesn't open that kink, it tightens it, which sets the stage for hemorrhoids, fissures, and in some cases prolapse. The rescue remedy, when stool is already stuck in the rectum, you don't need something that travels through the entire digestive tract over a couple of days. You need something that pulls water into the stool that's already sitting there. That remedy is 1 teaspoon of milk of magnesia, magnesium hydroxide, taken on an empty stomach with a full glass of water. Here's why this works when other approaches fail. Magnesium hydroxide is an osmotic agent, meaning it draws water from surrounding tissue directly into the stool. The hard, dry plug in the rectum begins softening from the inside out. Most people feel the urge return within 30 minutes to a few hours, and this time, things actually move. 1 teaspoon, about 5 milliliters, is the dose. More is not better here. Excess magnesium can cause loose stools, cramping, and in some cases electrolyte imbalances, particularly with frequent use. This is intended for occasional use when you're genuinely stuck, not a daily habit. A few important cautions. Do not use magnesium hydroxide if you have kidney disease, since your kidneys are responsible for clearing magnesium from the body, and impaired kidney function can allow it to accumulate to dangerous levels. Use caution if you have certain heart conditions or take medications that affect electrolyte balance. And if you're on prescription medications, check with your physician, since magnesium can interfere with the absorption of certain drugs depending on timing. A faster, more local alternative, if you'd prefer something that acts even more directly and quickly, a glycerin suppository is a strong second option. Inserted into the rectum, it works exactly where the problem is, drawing water into the stool while gently stimulating the rectal wall to contract. Most people see results within 15 to 30 minutes. For stool sitting right at the exit, this is often the fastest, gentlest option available, and it requires no prescription. What I'd encourage you to avoid, especially as a recurring habit, are harsh stimulant laxatives based on senna or bisacadil. These work by irritating the bowel into contracting, which can cause cramping and urgency, and over time can lead to the bowel becoming dependent on them to function at all. For an occasional stuck stool, osmotic magnesium or a glycerin suppository is the smarter, gentler choice. The position matters as much as the remedy. Here's something most people overlook entirely. You can use the perfect remedy and still sit on the toilet for 20 minutes with nothing happening, because your body is positioned in a way that works against you. Remember that puborectalis sling that kinks the rectum closed. When you sit upright on a standard modern toilet, that kink stays partially in place. You're essentially asking stool to navigate a bend that hasn't fully opened. The fix takes about a minute to set up. Get a small step stool, 6 to 9 inches high, and place it in front of your toilet with your feet resting on it. This raises your knees above your hip level. Lean forward slightly and rest your elbows on your knees. This single adjustment, knees above hips, body leaning forward, straightens the angle inside the rectum. The kink unfolds, and the path opens. The second piece matters just as much. Relax your belly outward. Don't suck it in, don't clench. Let it soften and push gently forward. Then breathe, a slow inhale through the nose, letting the belly expand, followed by a long, slow exhale through the mouth. As you exhale, simply let go. You're not pushing, you're releasing. This is the opposite of what most of us were taught growing up, to hold the breath and bear down. That instinct actually tightens the pelvic floor and clamps the exit shut. Belly breathing does the opposite. It signals those muscles to release. Combine feet up, leaning forward, belly soft, and a slow exhale, and stool that's been stuck for hours will often slide out on its own, with no straining required. Asterisk, preventing it from happening again. The goal isn't to keep a bottle of milk of magnesia in permanent rotation. The goal is making sure stool never gets that hard and stuck in the first place. 3 specific foods, each with real research behind them, do this remarkably well. The first is kiwi fruit, 2 green kiwis at dinner. Studies have shown that 2 kiwis daily improves stool frequency, softens consistency, and reduces straining within a few weeks. Kiwi contains a combination of soluble fiber, water-binding compounds, and a natural enzyme called actinidin that supports digestion. Eat the skin if you can tolerate it, since that's where much of the fiber is concentrated. Otherwise, scoop out the flesh. The second is ground flaxseed, 1 to 2 tablespoons daily, stirred into water, yogurt, oatmeal, or a smoothie. The word ground matters here. Whole flax seeds largely pass through undigested and don't provide the same benefit. Ground flaxseed provides soluble fiber that absorbs water and forms a soft gel-like mass that keeps stool hydrated all the way down to the rectum, preventing it from drying into a plug. Start with 1 tablespoon and a full glass of water, and increase from there. The third is prunes, 5 to 6 prunes, or about half a cup of prune juice in the evening. Prunes contain sorbitol, a natural sugar that acts as a mild osmotic agent, pulling water into the stool in a slower food-based version of what magnesium does. They also provide fiber and polyphenols that support healthy bowel function. Research has actually found prunes to be more effective than psyllium fiber supplements for mild constipation. Kiwi at dinner, ground flaxseed in the morning, prunes in the evening, simple, inexpensive, and quietly effective when used consistently. 2 mistakes that make things worse. The first is adding more fiber without adding more water. This is a significant and common error. Fiber works by absorbing water and forming a soft, bulky mass that moves easily through the bowel. But without enough fluid alongside it, that same fiber becomes denser, drier, and more prone to getting stuck, essentially the opposite of the intended effect. If you increase flaxseed, bran, or vegetable intake, you need to increase water intake right alongside it. A practical target for most adults is 25 to 30 grams of fiber daily paired with 6 to 8 cups of water, adjusted upward if you're larger, more active, or in a hot climate. The second mistake is increasing fiber too quickly. People hear that fiber helps and triple their intake overnight, which often results in bloating, gas, cramping, and sometimes worse constipation than before. Add fiber gradually. About 5 extra grams per week is a reasonable pace that gives your gut time to adjust. One more point, possibly the most important of all, honor the urge. The rectum has a built-in reflex. When it fills, It signals the brain that it's time to go. If that signal gets ignored repeatedly because you're in a meeting, driving, or it's simply inconvenient, the reflex begins to weaken. Over time, the rectum becomes less sensitive to the signal. Stool sits longer, dries out, and gets stuck. Respond to your body's signal the first time it speaks, not the third or fourth. When to see a doctor, most stuck stool episodes are mechanical, relatively harmless, and respond well to everything covered here. But the body also sends clear signals when something more serious is happening, and those signals deserve prompt attention. See a physician promptly if you notice blood in the stool, particularly dark blood or blood mixed throughout rather than just on the surface, since a minor streak from straining is different from anything more significant. Also seek evaluation for unexplained weight loss accompanying a change in bowel habits, a sudden and sustained change in stool shape, such as stools becoming persistently pencil thin, constipation that begins suddenly with no clear cause, especially after age 45, severe abdominal pain, vomiting, or an inability to pass gas, which can indicate a true obstruction and warrant same-day medical attention, and repeated episodes of fecal impaction where stool becomes so stuck that none of the remedies discussed here provide relief. None of this is meant to alarm you, quite the opposite. Knowing what warrants attention is what allows you to handle everything else with confidence. Putting it together, stool stuck in the rectum is its own distinct problem and needs its own solution. Standard laxatives that act higher up in the colon often miss the mark entirely, which is why so many people feel like nothing they've tried actually helps. When you're stuck right now, 1 teaspoon of milk of magnesia on an empty stomach with a full glass of water, or a glycerin suppository for something faster and more localized. Then position yourself correctly, feet elevated on a small stool, knees above hips, leaning forward, belly soft, breathing out slowly and letting go rather than pushing, to prevent it from recurring. 2 kiwis at dinner, a tablespoon of ground flaxseed in the morning, a handful of prunes in the evening, adequate water, fiber increased gradually, and responding to your body's signal the moment it arrives. Your body isn't working against you here, it's asking to be heard. Listen the first time, and it will rarely need to ask twice.